Good evening, everyone, and welcome to the SEMLEP Careers in Health and Care broadcast. This session will last around 45 to 60 minutes and will include a speaker presentation, followed by a panel discussion and Q&A. This session will help you learn more about the variety of different careers available in health and care. Questions for today's speaker can be submitted via the Q&A function on the right-hand side of your screen, and this will be open throughout the session. I'm delighted to welcome our first speaker, Paul Thompson, Education and Skills Manager with SEMLEP. Over to you, Paul.
Thank you, and good evening, everybody, and thanks for taking the time to join us this evening. Just to kind of introduce us and what this is about, this is a series of broadcasts that we're doing for the next 4 nights over different kind of sectors and occupational groups with growth and opportunity. So tonight is about health and care. Just to explain this strange organisation that I belong to, the South East Midlands Local Enterprise Partnership, we're responsible for the economic development within the area being Bedfordshire, Luton, Milton Keynes and Northamptonshire. And my role is to help and support with the skills development and getting people into employment. We've got about 886,000 people in employment in the area, population of about 1.7 million. And we see about 160,000 job vacancies every year. So it's quite a big number. The encouraging thing is, despite COVID-19, up until September, certainly of last year, we were seeing a growth actually in employment. Our employability rate is much higher than the national average here, and the nice thing is it's right away across the patch. Northamptonshire in particular has been very, very positive over the last few years in terms of growth of jobs. And in fact, in some places like Milton Keynes and Northampton, we actually have more jobs than working age population, which does explain some of the traffic sometimes. Bottom line is we have high levels of employment. Now, does that mean you're going to walk into a job? No, it doesn't, I'm afraid. There are various challenges, and we'll talk a little bit about those in a second. In terms of job vacancy trends, well, that's a slightly different picture. It's actually kind of been a reduction, certainly over the last kind of year or so, 2 years. The encouraging thing was we were starting to see an increase at the beginning of 2020. And unfortunately, then obviously we got hit by COVID-19. So it's been a little bit patchy. I'm pleased to say that we are starting to see kind of a growth again now. And we're back up to about 73% of the job vacancy numbers than we were before COVID-19. And it's been heading in the right direction for a little while now. So that's very encouraging. Some sectors, some occupational groups have proven to be more resilient than others, and I'm pleased to say that health and care has been one of them. Health and care obviously is very important to us, not just as individuals, but to us obviously as a local economy as well. It actually accounts for about 10% of all the employment in the area. So it's kind of fourth on our list, you'll see there. In terms of job vacancies actually within health and care, the picture has been slightly different. It's just been up and up and up. Several different reasons, really. Certainly expansion of the services, and that's because we do have a growing population in the area. People are living longer. We have an aging population. Hello, I'm one of them. And people need looking after. There's additional care support required as you get older, and so there's much more need there. There's also replacement need as people retire. And the other really encouraging thing, I think, from the sector is the fact that there's lots of new roles starting to appear, and lots of good entry opportunities for certainly young people to come into the sector. If we actually look at these job vacancies and the type of thing that is available, we track the job vacancies weekly. So this is actually the last 12 months in the area, and this is the top 50 job postings that we've actually seen. Now, obviously, there's a lot in there that are medically based, as you'd expect, but there's quite a few that are not, and that's to do with all the other kind of support functions that go with health and care. So you've got things in here like administration, things like services, cleaning, maintenance, that kind of thing, support with kind of food as well, and also you'll notice some digital as well. like every sector, becoming more and more dependent on digital kind of going forwards. You'll hear people talking about employability skills, and they are key to any kind of occupation that you're looking for, and employers obviously seek them. We kind of split it down into different groups. We've got a group called core competencies. You might have heard them called transferable skills. You might have heard them called soft skills. Trust me, they're not soft, they're vital. This is the top 10 that are associated with those top 50 jobs that I just showed. And you can imagine communication skills, teamwork, collaboration, organisational skills, probably the most obvious ones, but some of those other ones on there might not be so obvious to you. And, you know, they are skill sets that are required and need to be evidenced when you're applying for these jobs. And then obviously there are the specialist skills. So kind of working with patients, obviously, and mental health care in particular is on the increase, and there's an increasing need. Got paediatrics on there, which is to do with children. Lots of kind of different things, occupational health and safety, so kind of movement, people, health, well-being, that kind of thing. I mentioned digital and digital literacy in particular. So Microsoft Office, and in particular Microsoft Excel, is a requirement in certainly some of those roles. The one big thing, certainly from my experience of talking to people within the sector, and probably a phrase that doesn't appear on many lists when you're actually looking at employability skills, is empathy. And that's kind of understand and to share the feelings of another person. And you can imagine that's key in any kind of role in health and care. There are lots and lots of places to actually kind of go and explore and actually find out more information. Now, obviously, we've got our panel this evening, and you know, we'll answer some of the questions that we've had previously and some that will come during the night. But you can always go and actually search these kind of websites and portals and link pages. There's a ton of information out there, and lots of videos and that kind of thing where you can actually explore and look for more. Now, what we're going to do is this broadcast. That will be published on our website, but you can also get these copy of these slides. They will be actually put onto the website at our kind of labour market information webpage. So if you just go into semlep.com, you can be able to navigate your way through it and find what you're looking for. I hope you enjoy this evening. I hope it's of benefit to you. As I say, you'll be able to watch it again if you miss anything. So thank you very much.
Thanks so much, Paul. What a great presentation for our audience. Panelists, it's now time to kickstart our panel. We have 7 fantastic speakers joining us today, and we'll share their biographies in the Q&A thread. Vicky, we'll come to you first. Vicky, it would be great if you could get us started. Vicky is joining us at the Learning and Development Advisor with Northamptonshire Council. Vicky, can you tell us a little bit about your job and the pathway to your current role?
Hi, yeah. So when I was 18, I first started as a weekend job working in a residential home for adults with learning disabilities. And that kind of got me interested in that kind of work. I was always interested in working with people, but I hadn't really decided in quite what way. So that kind of kick-started me to thinking about that as a career. From there, I did my degree in learning disability at university and went on to work with adults with learning disabilities in various different roles. Ending up being a registered manager for a home for adults with autism. And from there, I kind of got interested in training people and ensuring that they were properly equipped for their job. So I moved from being a registered manager into working for the local authority as a workforce development officer. So looking at learning and development for everyone working in adult social care across the whole range.
Thanks so much, Vicky. We'll come to Sara next. Sara, as our audience will see from your bio that we've just posted in the Q&A thread, you are a clinical placement support midwife. Did you always know you wanted to be a midwife?
No, I didn't actually start my training until I was 35 years old, so quite old really. I had my own children and then I had a bit of a light bulb moment and decided I wanted to be a midwife. What's great about midwifery is we do have lots of students who are 18 straight from school. We also have student midwives who've had their babies, and it's great to have that variety. So yeah, I was a little bit older, but once I decided, that was it, and I've never regretted it.
Never look back. Thank you so much, Sarah. We'll come to Natasha next. Natasha, please could you tell us a little bit about your role? What is it that you enjoy most about your job?
Yeah, so I am a practice development nurse and I cover the medicine and urgent care division. So it's a big division. I've been in nursing since I was 18. Well, 17 actually, going into 18. So what I enjoy most about my current role is that I get to use all of the information, all of the experience that I've gained from being a healthcare assistant at 17 to educate and train the next generation of nurses and make sure that they are doing the right thing, that they are supported to be doing the right thing.
Thanks so much. It's important to share our knowledge to the next generation. And Marie, we'll come to you next. You're joining us as a business development manager with Home Instead East Northants. What attracted you to the health and care sector? I think you're muted, Marie.
I'd gone to university and done my business degree and followed it up with a master's in marketing. And I really then fell into a job within the hospitality industry for 15 years. But there was just always something missing, even though it was very customer focused and I loved enjoying working with the customers. There just seemed something missing that I wanted to offer a bit more. And then I heard about Home Instead and their American franchise. I love the marketing, I love the ethos of it. So came on board 5 years ago and it's been the best thing that's happened. So I'm currently now business development manager and recruitment manager as well, which gives me an insight into both sides of the business. So it's nice that I can develop the business and then also look for good calibre of staff that we know that will work well within the clients.
Thanks so much, Marie. We'll come back to Natasha now. Natasha, Sarah, perhaps you could tell us a little about your working day. What does it include?
So I work as a midwife, but actually my title is clinical practice facilitator, and I support the student midwives. So we've got around 60 student midwives at the hospital that I work at, and my job is really to look after them. So I organise their placements on labour ward, on the postnatal ward, out in community, and I make sure the midwives are supported in their role as practice supervisors and practice assessors. So that's really my day-to-day job, but 2 days are never really the same. So some days I might be meeting midwives, some days. So today I spent the day with student midwives on their very first day at the hospital, doing their induction and talking about shifts and professional expectations, their uniform, things like that, where to put their bag when they're on placement, what they might expect. So today's been quite a fun day meeting the students on their very first day.
Oh, thanks so much for sharing. Sabine, we'll come to you. Thanks so much for joining us. We're keen to demystify some of the roles available across the health and care sector. Are there any job titles or roles that our audience might never have heard of?
Oh, I mean, there's lots. I mean, there's over 350 different careers available within the NHS. I think often people first think of, you know, doctors and nurses. But there are so many, as Paul mentioned earlier on. There's so many different options, from finance to procurement, to estates, to healthcare assistants, look after the patients, and actually my role personally as well. So I work for the charity, for Bedfordshire Hospitals NHS charity. So I guess that's another role that people probably wouldn't kind of think of straight away, and certainly not one that I did either. My start in the NHS was actually quite personal. So my son was born 3 months early, so he was looked after by the neonatal intensive care unit. at the Luton and Dunstable Hospital. So that's where my passion for the NHS came from, and then actually I started fundraising and volunteering, and then from then on the role that I do now became available, which I absolutely love. So yeah, there's many, lots and lots.
Thanks so much, Sabine. And moving on to Katie next, can you sort of add on to what Sabine just said? Are there any sort of jobs or roles that our audience might not know?
Yeah, so my role in practice development, I didn't know this job existed when I started as a student. So I think within nursing in general, yes, in the hospital there's lots of roles, but within nursing itself there's so many different specialist areas. If you think of a condition, there's probably a specialist nurse for it. It's probably the easiest way to describe that. And if there isn't a role, there probably will be one soon. It's very developing. So yeah, that's what I'd add to that.
Thanks so much. We'll come back to Sabine next. Are there any areas within the health and care sector where shortages are being faced now or will be faced in the future?
I guess nursing and midwifery being one of the biggest areas is probably one, but I guess maybe some of the nurses on here might have better information on that one.
Thanks so much, Sabine. And Katie, we'll come to you next. Are there any other routes into health and care or nursing that you would like to highlight to our audience?
Yes, so when I started, I did the university route. So I finished my A-levels and I did 3 years at uni. But it wasn't until I started in the hospital that I actually realised the opportunities within the hospital there are to become a nurse or a nursing associate. All the other different roles. So like I said, you can go to university for 3 years if you wanted to. If you didn't fancy university, you could become a healthcare assistant at any of your local hospitals, and the majority of hospitals will offer apprenticeships or some kind of course to allow you to develop into the role that you would like to develop into.
Thanks so much. And Jo, thanks so much for making the time to be with us today. And perhaps you could talk to our audience about the apprenticeship opportunities that are available in the area.
Okay, so yeah, just building on from what Katie said, obviously apprenticeships are becoming very much another way to join traditional roles where you had to take the sort of the full-time university route. One I'd like to focus on in particular is the registered nurse degree apprentice. I know certainly from being out of schools, that's one of the ones that there's been lots of interest for, and up to now it's been very much offered to perhaps some of our existing staff. So as we'd heard, you could join potentially as a healthcare assistant and work your way up that way. And actually, I think what we're going to see for the first time this summer is some actual registered nurse degree apprenticeship opportunities being advertised. And basically what that does, it's the same qualification. It's just studying in a different way. So you would be employed full time and working towards your degree at the same time. So lots of opportunities within apprenticeships. We mentioned, it's not just about clinical roles, different administration roles. Another project that I'm working on at the moment is for pharmacy technician apprentices. So pretty much right across all the roles that we offer, there are more and more apprenticeships becoming available, which is really, really good news.
Thanks so much, Jo. Natasha, perhaps you could add to this. Are there any skills or qualities that have helped you in your career? For example, we've seen lots of students asking questions about resilience over the past year.
Yeah, so my background, so I started, as I said, when I was 17 and was pretty much thrown in the deep end and started in urgent care. So that's kind of like a ward version of A&E, if you want to think of it that way. So you have to build up resilience quite quickly, but also make sure you keep that side of compassion, and that's really important. So what some of the other speakers have said about is developing through the hospital, and that's the route that I took through the Open University. So that allowed me to grow my skills as a healthcare professional, but also work towards registration.
And what do you mean by registration for our students?
Yeah, so registration is with the Nursing and Midwifery Council. So nurses and nursing associates and midwives have to register with the Nursing and Midwifery Council, and that you have to meet certain proficiencies as a student nurse, midwife or nursing associate to be able to be signed off, as it were, and for the NMC to accept that, and for you to go onto a register where you have to show that every 3 years that you are maintaining your nurse registration, and unfortunately have to pay £120 every year for the pleasure of that.
Thanks so much for sharing. We'll come to you, Sabine, next. Can you tell us about some of the activities students could undertake to support them in their future career? Do you know of any work experience opportunities, for example?
Yeah, so for example, myself and my colleague, we've been offering virtual work experience sessions. Due to COVID, obviously, we've had to all adapt our working. So yeah, but it's actually worked really well. So with the virtual work experience that we offer, it's a huge range of professionals within the NHS. It's a live session for students to join, and they get to hear from a wide range of professionals, which actually they probably wouldn't be able to get in a normal work experience situation. So actually for them, it's brilliant, and we can cover a huge number of students as well. Obviously being virtual, the number's pretty unlimited.
Oh, I'm not sure. I think we may have just lost Sabine shortly. Jo, we'll come to you next if that's okay. Hopefully we can get Sabine back in shortly. Perhaps you could, Jo, perhaps you could shine a light on the professional development opportunities within the health and care sector. From what I can see, there are a lot of opportunities for career development.
Absolutely. I mean, personally, I've only been with the NHS for 5 years, but what I've seen in that time is actually once you're actually in whichever part of the organisation you join, the opportunities for sort of ongoing development and progression are basically there. There are all types of different opportunities. For some roles, as colleagues have already said, continuous professional development is very much part of that role. And you have to be signed off to meet registrations, etc. But that applies, really across all of the roles there. All of our organisations very much focus on personal development and providing those opportunities, be that sort of through formal study or opportunities to job shadow colleagues to understand how the system all kind of works together. But certainly endless opportunities there really once you're in, and that provides opportunities to move on to different career pathways even. So lots and lots available.
Absolutely. I think learning throughout life is a key that everyone can take. And Katie, we'll come to you next, if that's okay. Have you undertaken professional development throughout your career? Could you tell us a bit more about that, please?
Yes, so I studied at the University of Northampton for 4 years. I didn't actually get the qualifications that I needed to get into nursing, so I did a foundation degree, which was another route. I then transferred onto a nursing course for 3 years. I started on a surgical ward as a registered young registered nurse, and then I decided after a year that I would take on a master's degree. So there's lots of different opportunities when you come into nursing to develop your career. I decided to move into practice development because I like learning. I wanted to pass on my learning to others, which is a great role for me to do this in. So yeah, there's lots of different development opportunities. Yeah.
Thanks so much. And Vicky, we'll come to you next, if that's okay. It would be great if you could tell us what it was that attracted you to a career in adult social care.
Hi, yeah, for me it was just around working with people. So it's always, the people that you're working with and getting to know them and the variety of backgrounds, and just, generally the fact that no 2 days are the same as well. The fact that whenever you come in, every day is different. There's always stuff to do. It's definitely not boring.
Thanks so much for sharing. And Sara, we'll come to you, and could you please tell us about the opportunities for promotion for midwives?
just thinking about Northampton General Hospital where I work, there are over 200 midwives here. And so that is a lot of different roles. And obviously we have a senior midwife, that's our head of midwifery. And we have matrons who are in charge of different areas. We have specialist midwives who might just provide care during birth, or might just undertake sonography, so doing scans for pregnant women. There's specialist midwives who look after women with diabetes. There are a lot of different roles, and you can imagine out of 200, someone's always the boss, aren't they? And then someone's the boss's boss and the boss's boss. So there's a lot of different routes for promotion.
Thanks so much. And Natasha, we've had a student question submitted that we'd like to ask you, if that's okay. Our students want to know, what sort of part-time jobs could you do if you wanted to be working in health and social care?
So for especially younger people, tend to start off in the hospital as a host or a hostess. So that's giving out dinners or helping sort of clean the ward environment. So you find a lot of people do that after school or on school holidays, for example. So most roles you can do part-time, providing that obviously the service supports it. So if they did want to go straight into a nursing role, so as a healthcare assistant, that can also be done part-time. If you did want to do that, you're perhaps sometimes a bit challenged if you wanted to develop, in that if you were part-time, you might have to increase your hours to almost all full-time, but usually it's just the host or hostess for particularly younger people, part-time. That's all I can think of, unless anybody else can think of any.
Thanks. And Jo, again, we've had a student ask a question that we'd like to ask you. Do you know the best path to take to become a children's and young people's nurse? And once you've trained to be a children's nurse, can you help both in the ward and in A&E?
Wow, I'm probably not the best person to answer this because I'm not a clinical person, but I'll do my best. Obviously, the nursing qualification, you would specialise in adult or children's nursing, and then sort of progress from there. So I'm looking at others to perhaps help me out with some of this. I don't know if anyone would want to add, but it is obviously slightly different learning pathway, depending on which route you choose to take.
Thanks. Does anyone from our panel like to add to Jo's answer? Oh, no. Cool, thank you.
Do you want me to add anything?
Yes, please, that's really useful.
I was just going to say, so nursing, midwifery, so within nursing there tends to be adult nurses, children's nurses, midwifery is midwifery, then have learning disability nurses and mental health nurses, and the same for students. And it tends to be you follow one pathway for your degree. So if you were, say, a children's nurse, you would work on the children's wards. But I was just going to add about A&E. So you wouldn't go to adult A&E, but there is the version of children's A&E. So you would work on there. But generally you stay in your field. We call them fields: midwifery, nursing, mental health and learning disabilities. It's quite sort of separated.
Thanks so much. And we've had another student question that we'd like to ask Natasha, if that's okay. Natasha, can you tell our students what a day in the life of a nurse looks like?
Gosh, I think you'd be hard pressed to find any nurse that would have the same day as another one, but it all depends on where you work. So all I can do is based on when I worked clinically, because I don't work clinically anymore, I work in a teaching role. But traditionally you would do things such as personal hygiene for patients, so that's washing, dressing, feeding, making sure that they're looked after. Medication rounds, that's important, that they're done at least 3 or 4 times a day. So medication rounds, going around with the doctors to update yourself and update the patients on medical plans, going for your break at some point, and doing things like observation, so blood pressure, temperature, that kind of thing, writing notes, answering the phone, helping patients to the toilet, doing IV medication, lots and lots of things. There's the list is literally never ending, but somehow you make it through.
Thanks so much. And Katie, will come to you for another student question. You mentioned healthcare assistants previously. Can you tell our audience what it means to be a healthcare assistant?
So healthcare assistants, basically, they provide I'd say the fundamental care that nurses do the medication and things like that, whereas healthcare assistants are there with the patient all the time. They probably know the most information about that patient because they're the ones caring for them, providing that personal care, feeding, toileting. So I'd say it's a really enjoyable role and also honourable, because that person's letting you into their life that they might not have shared with other people. They're really opening up to you. So I think it's actually a really special job to start as a healthcare assistant, because it does mean that you get the most interaction with our patients.
Thanks so much. And Marie, will come to you next. Did you always know what you wanted to do with your career? Oh, I think you're muted again, Marie.
No, I did. Well, actually, I did want to go into teaching, but I was quite fortunate to gain a sponsorship to go to university. So I kind of grabbed that. Yeah, I was literally in a casino management for 15 years, which, as you probably know, the hours were just all through the night and not very good with a family. So that's why I decided to go into the healthcare industry. But as I say to a lot of the caregivers that we have, any kind of work experience is so vital. We have caregivers that started with us 5 years ago that are now ambulance drivers, that are now nurses, and even the top person that gets all grade A's in university and school might not necessarily make it in healthcare, because, like Paul said, you have to have that life skills, communication, empathy, and that is something that can't be taught. So I always say to the people that we get in with us, having empathy and communication is such a valuable skill, because you can't be taught and it's just in you.
Thanks so much, Marie. And building on that, we'll come to Sara next. One of our students is interested in the emotional resilience needed to be a midwife. Is this something you've built over your career?
Yes, I would definitely say so. So to train to be a midwife and to educate yourself takes 3 years. So during the 3 years, you're learning such a lot and building your resilience then. So then, as Natasha was saying, you then join the register as a registered midwife. That for the first year after you qualify, you do something called preceptorship, which is a year that you're supported in the workplace. So you don't have to stay and work at the hospital where you trained. So you might train at Luton and then work at Northampton or Milton Keynes, but every hospital looks after the nurses or the midwives for that first year with extra support, because again, you're learning then to not be a student, but to be a midwife or a nurse. And after that 1 year, you then go into your main role. So you might work on labour ward. And you are part of a team. This is what's great about healthcare, is none of us really work on our own. We really enjoy working together. So if I'm working on labour ward, there's lots of other midwives around me, there's lots of maternity support workers, and the team spirit is really strong and powerful, and that helps us all be more resilient, is knowing who you've got for support. Because some days might not be a good day and other days might be great, but it's the ebb and flow, isn't it? And it's having people in the same role as you to share the experiences. The highs and the lows in midwifery can be very high and very low, and you get used to those days with your colleagues.
Thanks so much for sharing. And Sabine, we'll come to you next. The audience are interested in hearing more about the virtual work experience. What does it include for young people and where can they find out more?
Okay, so the virtual work experience that we do, it's a 6-hour session and they have presentations, so live presentations, about 15-minute presentations on people giving insights into their roles and their careers, and basically it's called A Day in the Life of the NHS, so a huge range of different professionals all giving their insights. So I can pass you on the details if you like at the end for people if they want further information. But also, as other people have mentioned, there are lots of other useful websites and links for people to access. So NHS Careers website is fantastic. There's lots of information on there about all the different roles. You can do like a find your career quiz and put in your personalities and your preferences, and it brings up lots of different roles. And also Brighton and Sussex Medical School, they have a really good online virtual work experience as well, which might be worth students having a look at. And things like the student rooms as well is another great website for students to look at.
Thanks so much for sharing, Sabine. Some useful resources to have a look at for our students. Natasha, we've got another student question for you, if that's okay. I know that previously you mentioned that you've moved from a clinical role to a teaching role. This student would like to know, would I always have a job as a nurse? I'm worried about not having a job for the future.
Yeah, and I think if you speak to some students, that's a worry that they have. And there is not anywhere in this whole country where they aren't crying out for nurses, and that will only ever increase. So the role of a nurse, particularly now, is a lot more advanced than perhaps it used to be even 10 years ago. So we need more nurses, but we need more highly skilled nurses, and the more highly skilled you become in your nursing role, the more desirable, as it were, that you become. So I don't think I've ever worked a shift or been at work where at least one area somewhere isn't short-staffed, because they either don't have enough nurses, or there's a high sickness rate or something along those lines. But you will always have a job.
Thanks so much, Natasha. And Joe, we'll come to you for the next question from a student. A student has asked, could I decide to train as a nurse later in life, and will my life experience be beneficial?
Absolutely, yes. And I think some of our panel members have done that as well. It doesn't necessarily mean that the first job you take up is going to be your job for life, as it were. I think we all gain something from the different roles that we undertake throughout our working life, and from those we gain sort of life skills as well. So not just vocational qualifications and skills. So absolutely, and one of the programs I look at is really sort of people that want to come into nursing later on. So it really is, you know, different opportunities at different points in your career.
Thanks so much, Joe. And Katie, we've had another student question that we'd like to ask you. Is there anything you wish you'd known when you were a teenager that would have impacted your career choices?
I don't think there would have been anything particularly. I don't regret becoming a nurse. It's the one thing that I've always known that I wanted to do. I actually wanted to be a midwife before I became a nurse. And maybe later on in life I'll become a midwife if that's what I fancy. You can't just limit yourself to one thing in the NHS. You could become anything that you wanted to. I think the world's your oyster when you kind of have that healthcare bug in you.
So just building on that, you can change specialisms once you've qualified.
Yeah, once you've got it. It just depends obviously on what the hospital that you work in, if they offer any kind of routes, or you may have to retrain, but it just depends what's available at that time. I mean, I'm enjoying being a nurse at the minute. I don't see myself being a midwife within the next 5 years, so it may have changed from then to now. So
thanks so much. And Vicky, we'll come to you next, if that's okay. Did you have any preconceptions about the health and care industry before you joined? And has this changed over time?
Not really. I came from a family of nurses, so I didn't know much at all about adult social care. I knew quite a lot about nursing. So I kind of came into it with fresh eyes, and I think that really helped, kind of not having any ideas about what adult social care would be like. I worked with a whole range of adults with learning disabilities, so I treated them all as individuals and got to know them all, which I think really helped.
Absolutely, thank you so much. And Sarah, we've got lots of questions for you. The students would like to know more about the routes into midwifery. A student has asked, could I do a nursing course first and then do a midwifery course? Will level 1 and level 2 health and social care be useful?
So to answer the last bit first, it sounds like level 1 and level 2 would be useful. I think anything like that would be useful, wouldn't it? You can do, so the routes into midwifery, the main route is direct entry to a university and to do your BSc, that's a bachelor's degree in midwifery, and that's a 3-year course. And you can do that at University of Bedfordshire, University of Northamptonshire. Do we have some other universities in our area? If you think of any, Paul, will you say them, please? So you can do those locally or up and down the country. You can find a university that offers midwifery. That's the quickest route, is 3 years. The other option is do your nursing first. That's a 3-year nursing degree. And then, if I can persuade Katie, it's 18 months top up to become a midwife if you're a nurse already. So you could do 18 months afterwards. Another route, which is quite a new thing, I don't know if Joe knows anything about this, is there are 3 places in the UK that offer midwifery apprenticeships, and one of those is Greenwich in London. I think Bedford is another, and I can't think of the third. It might be West London, University of West London, I think. So that is quite a new idea, that you could be an apprentice maternity support worker and then have a route into midwifery. So there's quite a few different ways.
Yeah, absolutely. Lots of options for our students. Sabine, we have a student question we'd like to ask you. What useful advice or mentorship have you received in your career?
Oh, that's a good one. Useful advice. Well, I mean, working for the NHS, I think, as we've all said, passion is maybe not necessarily some advice, but it's something that we all share working within the NHS. So being passionate about what you do, being passionate about the people and our patients, because at the end of the day, that's what we're all here for. So yeah, being passionate, I think, is key. Passionate about what you do, and just putting yourself out there as well. There's so much information available, so really just push yourself out there. If you can, do volunteering as well. I'd say that's a good bit of advice for the students. Just, you need to do anything you can to make your applications stand out from others. It can be tough, so you need to do things that make yourself stand out and, you know, put yourself out there, really.
Thanks for sharing, Sabine. Natasha, a student would like to know, has said, I'm scared of blood. Could I still be a nurse?
That's an interesting question. So I think my first instinct is to say no, because there is sometimes a lot of blood, but I think you'd be surprised how much you can deal with when you put your nurse head on. There's lots of things that we think, I could never cope with that. My midwifery colleagues, I'm sure, would be able to put their hands up and say that if you asked me when I was 17 whether I could deal with any of the things that I've dealt with, I would have said no. But you find a way to deal with it, and you actually find that when you're doing these things, that the fears that you thought that you had aren't actually real fears. It's probably the only way I can answer that.
Absolutely. Take a challenge head on. Thank you so much. And Marie, we'll come to you next. Our students are always keen to hear about the highs and lows in jobs. What are the main, some of the main challenges of your role?
The main challenges are getting enough home carers to be able to do the job. At the moment, I could employ 30 or 40 tomorrow and still be able to create more jobs. So that's challenging. Obviously, we do take on, our retention is very good, but we do take on some carers that then obviously progress, and that's fantastic. They're progressing on to better things in terms of NHS. Yeah, so that is one of the challenges, and I can't see that ever changing, if I'm honest. I think it's always going to be the biggest challenge within home care.
Thanks so much for sharing, Marie. And Sarah, please can you tell us some of the main misconceptions that people have about midwifery? For example, some people may think that midwifery is more about caring for the baby than the mother.
Yeah, I would say that's the main misconception, is that it's a lot to do with babies, and we do like babies, but actually if you think pregnancy lasts for 9 months or 40 weeks, the birth tends to maybe be 10 hours, 12 hours that a woman's in labour, and then midwives see the woman afterwards for about 10 days. So if you think about the bulk of our care as midwives is actually when the woman's pregnant, where the baby's inside. So it's a lot more about pregnancy, and it's about helping women understand their choices around their pregnancy and how they'd like their birth to be and their experience. So it's a lot about what does the woman choose, what would the woman like, and actually the birth is a small but very important part, and then the 10 days afterwards is when we do get to see the babies, but we're usually weighing the baby, checking the baby's well, rather than just having cuddles.
Thanks so much. We've got time for a couple more questions. Jo, we'll come to you next. Could you tell us more about the role of a social prescribing link worker, and how does this differ from social work?
Okay, so the social prescribed link worker is kind of quite a new role, so that was introduced last year, and that's really recognising that not everything where we're also perhaps having hard times feeling, not ourselves, let's say, it's not always necessarily about medication, so it's about what other support does that individual need. So social prescribed link workers are working out linked to our GP practices, really providing that support to individuals within the community, and perhaps helping people that have become isolated, helping them to join in activities. It may be linked to general well-being, health and fitness, etc. They are a sort of more of what I would call an entry type level role, whereas obviously a social worker is a degree level role, but actually a really, really key part, and certainly thinking about the impact of our lives at the moment, it's an extra support role that we're really pleased to see introduced.
Thanks very much. And Vicky, we'll come to you. One of our students has asked what sort of voluntary work would you recommend to help them in their future careers?
Anything that involves working with people, so it could be working with adults with learning disabilities, it could be working with older people. There's so many opportunities, because the one thing that people are always short of is time. So going in and reading to people, spending time with people. I've done some befriending work as a volunteer as well. So spending time, just taking people out, going out with someone, getting, volunteering to take someone out my own age and just do what I'd normally do, go bowling, go to the pub, obviously pre-COVID, but yeah, all of those sort of things. People desperately need just people to go in and talk to people. So it's all of those kind of roles that are out there. Most residential homes will have some kind of route for volunteers, and just having those people in for that extra time.
Thanks so much for sharing. And finally, to all of our panelists, as we draw the session to a close, we have one final question for each of you to answer, and I'll go around and say your names. what is the one piece of advice you would like to leave our students with? And we'll go to Sabine first.
Yeah, I think I've kind of briefly touched on it earlier, but what I would definitely say is, yeah, just find out all the information you can, put yourself out there. At the moment, work experience is obviously quite difficult, but any online experiences that you do, keep a note and keep a record, because universities will recognise this as well. And yeah, volunteering, as I said, we have a student volunteering programme at the LMD, normal times. So yeah, have a look at your local hospital as well, find out information and see what they offer. Sorry, that wasn't quite one piece, but
that's absolutely fine. Thank you so much, Sabine, for joining us this evening. And Natasha will come to you next.
So I think my bit of advice would be, if healthcare interests you, is to look and really look into all of the roles that there is in healthcare. As I think one of the other panelists said, it's easy to think of healthcare as doctors and nurses, but there are so many other things that you could do. So have a real hard look into what all of those roles are and how you get into it, I think would be mine.
Thanks so much, Natasha. And we'll come to Jo next.
Okay, so my advice is thinking, if you're going to apply for a degree placed, an apprenticeship, a vacancy, whatever it might be, that application, think about what you can include. So you need to be the application that stands out. So what is going to be on your form, on your application, that makes you stand out? So all of those things we've talked about, just make sure you give yourself the best possible chance, make it interesting, let that passion shine through, and take the time with your application to make sure it does.
Thanks so much. We'll come to Sara next.
I would say think about, do you want to be there at the most important times in people's lives, when they're poorly, when they're well, when they're having babies? Then a job in healthcare would be really good. And I would say work really hard at school, do your best, find the route into nursing or midwifery that's going to suit you. But I think work hard and follow your dreams, don't give up on it.
Thanks so much. And we'll come to Marie next.
Again, I think it's been mentioned, is just get as much experience as you can. Doesn't matter how little it is, all of it adds up to the final product and service at the end. So as I said, just try and expand them life skills, and yeah, get as much as you can before you start the world of work.
Thanks, Marie. And Katie, over to you.
I'd say just go for it. Don't let anything hold you back. Like I already said, I didn't get the grades when I first applied into nursing, so I just kept trying, and here I am now. So just keep going. If it's meant to be, it will be.
Thanks, Katie. And Vicky, over to you.
Mine would be just keep an open mind and try out as many things as possible. If you've met one person with a condition, you've only met one person. So, you know, don't remember everyone's an individual. Don't write off working with a group.
Thanks so much. A huge thank you to all of our speakers for joining us today, and to our audience for tuning in and asking a lot of questions. We have posted a feedback form in the Q&A thread. It would be great if you could complete this. We look forward to seeing you all for tomorrow's broadcast on engineering and manufacturing. Have a good evening.
Thank you.